Hi everyone, I'm Dr. Krishna Reddy Taduri, consultant endocrinologist, Medicover Hospitals, Madhapur. So many patients are asking me about how to maintain weight or how to lose weight because majority of the time we see this obesity as a major risk factors for the type 2 diabetes. So is before COVID-19 pandemic, this diabetes and obesity was the biggest pandemic that was going on earth today. So this diabesity, this is called diabetes. So this is growing in the epidemic proportions. So which should be tackled to have a better results in the and a better glycemic control. So this obesity is mainly because of lack of physical activity, poor nutrition, and some of the medication that used for the diabetes also can cause this type of problems. So this central adiposity is that accumulation of the fat over the abdomen and accumulation of the fat over the liver and other visceral organs like pancreas and omentum and other fats. This leads to the insulin resistance. So to overcome this resistance, we may need to give more higher medications, high power medications, and sometimes insulin to overcome this insulin resistance. So this is the problem is going to happen if you won't control your weight properly. So to control your weight, you should mainly focus on your lifestyle changes. So that should be in the form of proper nutrition, which contains a low carbohydrate and low fat diets with a good amount of protein and fiber. And also you should have a good exercise in the form of both fat burning exercises as well as muscle building exercises. If you see for the nutrition part, so that should contain a very low amount of simple and processed sugars, and it also should contain very low amount of carbohydrates. It should be of a more of it should contain more green leafy vegetables and vegetables, salads and sprouts and pulses, lentils, legumes, and a good amount of protein in the form of egg whites or chicken or fish or white meats like chicken or fish. And also you should have a sprouts and 5 to 6 badam. So this and paneer, soya, these are also good amount of protein sources. And this should be a major part of your diet, and the diet should not have any amount of oil in your curries or any even non-veg meals also. And as far as possible you should avoid the fry items, so and also the outside packeted food which contains a very high amount of saturated fats which are very bad for your health. So you need to focus on your diet as well as you need to do a regular exercise, especially if you don't have any foot problems or osteoarthritis problems. You can go for a regular walking or jogging or running or any form of aerobic exercises you can do. But if you have a foot problems or osteoarthritis problems, that will be difficult for you to do going for a running or any other physical activity. So in those scenario, you can do a whole body exercises or muscle building exercises like weight bearing exercises you can do. And swimming is also very good exercise for the type 2 diabetics. And apart from this, the weight is also majorly influenced by what medications you are using. Like some of the oral diabetic medications like sulfonylurea group of drugs and pioglitazones. So these are the medication that can cause weight gain. So instead of the weight gaining medication, you can switch to non-weight gaining medications with a low risk of hypoglycemia like metformin and other DPP-4 inhibitors like gliptins, and also SGLT2 inhibitors. And one of the major injectable forms of medication that can have a good impact on weight loss are GLP-1 receptor analogs like liraglutide, semaglutide, and dulaglutide, so which are also available. So based on your need, you may consult your doctor for a better medication to control your weight. So if you can reduce your weight, we can reduce your medications and even insulin doses also. So that is a rewarding.